good morning. First of all, may I say thank you to our city staff. There are people who go out and do this work year in and year out, and Mark described how they do work on a number of fronts that have to do with keeping the roads safe and clean of snow, and so I want to thank them because they work year in and year out, and they're often people who are not recognized, but we rely on them. We know they're there and that they're going to be there no matter what happens. And of course we know that in our city, as a function largely of the weather and the freeze-thaw cycle, that potholes are just a reality, but they are a safety risk. They are a risk to property in terms of the well-being of people's vehicles, and they're just not sightly. And so it is an annual assignment that goes on through the year, but principally gets underway again in the spring. It's one of the sure signs that spring is close at hand, is that you're able to get on with pothole blitzes and do that kind of work. And I think, as Mark mentioned, we repaired this year so far, up until now, in the beginning of the blitz season, as it were, 30,000 potholes with thousands more to come. Just as a matter of interest for people, you know, in terms of their tax dollars being hard at work, it costs about $25 to repair each and every one. But again, when you look at the safety factors, when you look at the damage to people's property, it is an investment that we have to make. We've had a better run the last couple of years, partly because traffic levels have been down because of the pandemic, and partly because of the weather, which this year, as you might recall, going back through the winter, we've had fewer of those deep freeze and thaw cycles, and that helps to create fewer potholes. But the winter's not over yet, I regret to inform you, and so we still have to get through the rest of the cycle in terms of the weather. We have about 125 people or thereabouts out today, and that's just an indication of how seriously we take this and how many resources we devote to this. Upwards of $5 million a year to invest in making sure that we repair as many of these potholes as we can. And again, I join Mark in inviting you to call 311 or otherwise to let your councillor know by email, or let us know by email at toronto.ca about potholes that you see, because that's the best way we have of figuring out where they are. One other note that I would like to just touch on before my time is up for today, well, two actually. First of all, I hope people understand the pothole repairs do sometimes cause some disruption to the flow of traffic and cyclists and so on, and I hope people will understand that, like the water mains we're repairing, like the streets we're redoing, these are necessary repairs that we have to do. It's the same with the TTC closures. I did not want to run an administration that postponed these kinds of things because it would cause people frustration and so on. We're not deliberately trying to do that, but we are trying to keep up with these repairs in a better way than might have been the case in the past, and we're making the investments necessary to do that in the interests of safety, in the interests of just having a city that functions properly. And so I hope you'll be patient with these people when they're out doing their work on the pothole repairs, because they will sometimes have to close a lane of traffic. And I hope you'll understand that we're going to continue to run the city in such a way that we get this work done, albeit that it does sometimes cause some inconvenience, but the inconvenience is worth it in the context of better water mains, safer streets, better roads, and all the other kinds of infrastructure, a safer and better transit system. The other note that I wanted to touch on was this. Daylight saving time is upon us again. The good news is that that must mean it's spring, and we're going to have daylight saving time, and it's going to stay lighter later in the day. But the cautionary note is that it means, especially in the morning for the next little while, that it's going to be darker. And I hope people will adjust their driving habits accordingly, drive slower, turn slower, keep a more eager eye out for all kinds of people around you, whether it be cyclists or pedestrians or just other drivers, because the combination of that and the loss of an hour's sleep does make a difference, and can lead to the collisions that can cause injury and even death. So I hope people will please keep that in mind as we get into daylight saving time. So on that note, I am very pleased to be here not only with Mark and with his staff, and I thank them again for all their hard work, but with the very hard-working chair of the Infrastructure and Environment Committee, one of our very diligent Scarborough councillors, and it is a tribute to her and to her hard work and to her abilities that she is, as a first-term councillor, the chair of a committee and a member of the executive committee for the city, which is unusual for somebody in their first term, but she's full value to us, including, I should tell you, a very interesting event that she chaired the other day that I was able to visit, which is something called Women for Climate. And it is something that she's going to lead an effort on, to have as many women and more women involved in tackling the huge challenge of climate change that exists for our city and for our country and for the world. And it's something that she's got deep professional qualifications to help us with, and a deep commitment as well, and that's going to be a very great value to the city as well as we go forward. So on that note, may I introduce Councillor Jennifer McKelvie.
Good morning. It's great to be here with Mayor John Tory celebrating the kickoff of the annual pothole blitz. This is my first time being out with the crews, watching them fill potholes. There are 64 crews that are out today. Please give them a wave if you see them out, but also please do also give them some space as they're out there doing this very important work. At home, we're all starting spring cleaning, so it's great that the city is also starting to get that too. I'd like to thank again Mayor Tory for coming out today. He's been a wonderful supporter of all the work we're doing at the city to combat climate change. Some of that work does mean we're going to get more wet, more extreme weather. Unfortunately, that could mean more potholes, so it's great that we're out there getting a head start on that today. Thank you.
Any questions that you have today that have been submitted to you or that you have on your own? Okay. May I make a brief comment on just for you then on the injections? I'm very pleased at the fact that we're ramping up as supply permits our vaccination effort in earnest. We're over 260,000 now in terms of vaccinations that have been delivered to people. We did have the new registration opportunity that started on Friday, and it resulted in close to 8,000 people signing up, and they've signed up for injections across the 3 mass immunization clinics that will open next week. And of course, all of this is driven by supply, and I'm delighted at the fact that we have some additional supply that has been made available to us, and the more that we get, the more we can do with some 20 plus clinics in operation across the city over the weekend, with our hospital friends and other community organizations, making sure that we can get as many people as possible to get that needle in their arm that will make a big difference as we try to head towards a greater, more normal way of life, and indeed hopefully the reopening of more of the city for activities, recreational activities, and of course for business as well. I'm very heartened at the pace of vaccination that is coming along in the City of Toronto, and of course that's been dependent upon supply. We've now done 239,000 plus inoculations of people with the COVID-19 vaccines, and of course they're happening now in some doctors' offices, in pharmacies across the city, and in many clinics in hospitals and other places. And we have available to us next week the first of our the first 3 mass immunization clinics, and I'm pleased to report that since registration opened up on Friday, we've had close to 8,000 people that have registered, and with more to come as the registration system is available to people. And so I hope people will get registered. I hope they will get vaccinated. This is going to be the best way in which we can get the city back to normal, get people back to their normal activities, get business open again. And of course, how much we do is dependent upon supply. We have more clinics ready to go as soon as there is more supply available. But it is something that is a hugely important step forward for the city, for people to get vaccinated, to make those appointments, to go to toronto.ca/COVID-19 and sign up if you're over 80 at this point in time, but and 60 to 64 for the pharmacy. So please take advantage of the opportunity to do that.
One question, actually, if you don't mind. If you're going to get your vaccine shot, would you choose, because one has more potency than the other? What do you think on that?
Because I've been asked so often by people about one vaccine versus another, I asked the medical officer of health about that, Dr. Davila, and she told me that she, as a doctor, and well learned in this stuff more so than people who are not doctors and scientists, that she would take any one of those vaccines on the basis that all of them are going to provide a substantially enhanced degree of protection against COVID-19. And I think as a result of that, people don't really need to be concerned about that. There's no reason why they can't ask questions, but I think they need to rely on the fact that all of them have been approved by Health Canada, and that no vaccine would be offered to people that wasn't going to be effective or that would in any way cause them any grief. And so it's fine to ask a question or two, but I think people can rely on the fact that they're safe because they've all been approved for use, and that our own medical officer of health says that she would take any one of the 4 herself, as I would. Thank you.